Hi guys, how are you? I'm Brandon Ayres from the Cornea Service at Wills Eye Hospital and Ophthalmic Partners of Pennsylvania, and these are going to be my financial disclosures. Now today I want to talk about a new device that I got to use that helps make a complicated case a little bit easier, and that is the Amon Forceps for Intra Scleral Haptic Fixation. Now the video is going to be a little bit blurry and I apologize for that, so I'll show you some video of what the Amon Forceps is. Essentially, it is a 27 gauge sharpened cannula or a 27 gauge needle that has a small forceps that reaches out of it. And this forceps helps you to grab the haptic of your IOL for intrascleral haptic fixation. And it probably could be used for other things as well. Now, the Amon Forceps is made by Goiter, but in the US it's distributed by VisionVentions. And I'll link them in the description below if you want to go to the website to check it out. Outside the US, I'm not sure who distributes the device, but I'm sure you can find out with a little bit of a Google search. All right, so let's get into the OR here. You can see this case, patient's aphakic with a lot of corneal edema and a pretty large temporal iris defect. Plan is to use intrascleral haptic fixation to place a secondary lens and then close up the iris defect. So this is the Amon Forceps, and I should say that VisionVentions did not sponsor this video, but they did provide me the sample to use. We're going to use a ZA9003 in this case. You can use any 3-piece IOL you want, but this is the ZA9003, an acrylic lens with PMMA haptics. And since this was my first experience with the Amon Forceps, I didn't want to change my technique too much. So for the leading haptic, I still used a thin wall 30 gauge needle to get that leading haptic, because I like to release the haptic, and you really wouldn't be able to do that with the Amon Forceps as it's on a handle. Now this is the Amon Forceps. I was concerned that maybe it wouldn't be real sharp, but I was totally wrong. As long as your AC maintainer is on, this made the sclerotomy very easily, making it very easy to get that trailing haptic. Now you can see it presenting right there, and see the forceps is open. I've got the little picture so you can see it. So the little forceps is reaching out of the lumen, and all we have to do is grab the haptic. You don't have to really lace it into the lumen at all. And then you can externalize the haptic and just grab it with a tire so that you prevent it from reprolapsing, and then you can melt your little nub on the haptic. Now I did make my nub a little bit bigger than average this time because that's a 27 gauge instrument, not a 30, for fear that it may prolapse to the sclera, but I probably overdid it. I don't think you have to make the little nub all that big. And then we'll push these back into the sclera so they're nice and flush and don't become exposed later on. And you can see how nicely that implant centered. I'll tell you, the Amon Forceps worked really, really well, easier than I thought it was going to be to use, and it definitely simplified that trailing haptic issue with intrascleral haptic fixation. Now we're going to try and reestablish our lens iris diaphragm by placing a 4-throw pupilloplasty through that temporal iris defect. That's just to help me keep air in the anterior chamber a little bit easier, because we're going to end this case with an endothelial keratoplasty. So just cutting the sutures inside the eye after the 4-throw pupilloplasty is complete. And now we'll move on to the endothelial graft by removing the patient's descemes and endothelium, and then we'll replace it using a Busin glide. So in the end, again, the first time I used the Amon Forceps, but it really took quite a complex case, simplified the secondary implant portion, made it much easier, which allowed us to get through this case quite easily. Well, there it is, guys. That is using the Amon Forceps for intrascleral haptic fixation. In this case, it definitely made my life easier by making the surgery more efficient and easier for me. And that translates into easier recovery for the patient. I suppose if I had it in a perfect world, I'd make it a 30 gauge, but as a 27, it ended up working very nicely. Hopefully you've seen something in this video that you can take back to your own patients to make their lives easier or make your surgery easier in the operating room. Thank you so much for watching. Once again, I'm Brandon Ayres from the Cornea Service at Wills Eye and Ophthalmic Partners of Pennsylvania.